So we've actually seen a plateau in the number of hospitalized patients. Today we stand at 17 patients, and really for the past 2-3 weeks, we've been in that range 10 to 20. I think our low has been about 13 in total. Well, we've seen some clues as to how it may be different. Uh, as many are aware, there's been a lot of talk about this fourth wave and some fairly strong opinions coming out of CDC and other scientists that we may expect a significant fourth wave. What we're seeing, I think, both nationally and locally, particularly locally, is that patients coming into the hospital tend to be a little younger. This makes sense as our over 65 folks have been vaccinated, high percentage have been vaccinated. We've been seeing perhaps fewer intubations and fewer deaths. So hospitalizations have plateaued. Our average age is a bit younger, and there have been, we're crossing our fingers, fewer deaths. So perhaps a fourth surge or a fourth stage of this pandemic may reflect those particular trends. You know, that's a good question. I think there's a tremendous amount of uncertainty with the next wave. Because remember, we are running a race here. We're racing the virus with vaccinations. So as our vaccination goes up, the number of susceptible folks will decline. And at some point, there will be reduced transmission due to herd immunity. We guess perhaps at between 70 and 80% of the population, but all of that is speculation. So I think we're not going to really know where a peak might be, how that peak might affect hospitalizations, deaths, and the use of medical resources, such as impacting hospitals, etc. But the next couple of weeks, I think, will be telling. As nationally, we've seen infection numbers go significantly higher over the past couple of weeks. That may presage a surge in hospitalizations. We just have to wait and see. Well, I think it tells us it's still here, and it's still transmissible, and we still haven't hit herd immunity. And we kind of know that. We know that about 30% of the population nationally, at best, has had at least one shot, and the maximum protection for the Moderna and Pfizer shots is two. So we've got a ways to go before we get herd immunity. The continued onset of cases suggests that we have to keep our guard up. And I think this has been the subject of a lot of discussion on the national stage. At the same time, we're hearing the CDC warning of a possible fourth surge. We're seeing certain states open up the economy in such a way that I think is messaging to the general public that the great danger is over. There are others who are saying the great danger is not over. I tend to be in the essentially cautious second camp to say that we really have to keep our guard up, mask, avoid congregate settings, model that behavior even if you are vaccinated at this time, because most of the population is not. Hand hygiene, common sense that this virus is still out there, it is still killing people, and the practices that we've all learned over the past year are still very helpful in limiting the damage this virus can do.